I think it's the whole concept of involving patients and their caregivers, families, in their care. And so I think when you look at how we provide care as healthcare providers, which is one of the things that I do, as traditionally it's always been about what we can do and how we can solve problems. But I think for me, one of the biggest ahas was in that decision making is how do we involve patients and families. So not just asking them for their opinions or if they are agreeable to some of the suggestions we're making, but actually having them participate actively in that decision making. And more importantly, the fact that we can coach them, because a lot of times patients and families and caregivers really don't know what those options are in terms of not just treatment options, but options for housing, options for modifying their homes on discharge from hospital, options for accessing social services. But as healthcare providers, if we have the information on those resources, we can engage these patients and families and caregivers and coach them in terms of making them make the decisions based on the information that they have. So that was one of the big aha moments for me. I think action should be taken at various levels, at the healthcare provider level, at the health government level, and also other sectors that intersect with health, so social services. And what kinds of actions am I talking about? Is I think in every aspect of decision making that involves patients and families and caregivers is providing the opportunities to actively participate in the decision. So provide the information, provide the resources, and if they lack the skills or the knowledge to make the decision, then help them with it. So in other words, I think at every one of these levels, aim to support decision making amongst patients, families, and caregivers.